So I would say that I routinely use circulating tumor DNA tests to help determine most appropriate therapy for my patients that have metastatic or stage 4 breast cancer. And I'll give you an example that I think is quite common in breast cancer practice, which is that for patients that have a hormone receptor positive, HER2 negative metastatic breast cancer, their initial treatment that they often receive is usually some form of anti-estrogen therapy, and then another drug called a CDK4/6 inhibitor. Um, these drugs have now been in use for many years and have dramatically improved outcomes for our patients. But at some point, the cancer usually does learn how to grow or spread to other places in the body, despite that initial therapy. And the treatment that we give as often the second line of therapy is usually very much determined by the molecular profile of the tumor cells. So another example is that patients with metastatic hormone receptor positive, HER2 negative breast cancer often have mutations in a gene called PI3 kinase in the tumor cells. There are now two FDA-approved drugs for individuals with this disease that have PI3 kinase mutations. They are alpelisib, which is a PI3 kinase inhibitor, and capivasertib, which is an AKT inhibitor. And so routinely, when patients have initial progression of their cancer on that very first treatment that I prescribe for stage 4 breast cancer, if circulating tumor DNA is able to identify an activating PI3 kinase mutation in the tumor cells, I then would use either alpelisib or capivasertib, or perhaps even enroll that patient on a clinical trial of a novel PI3 kinase inhibitor in combination, usually with a different form of anti-estrogen therapy, as their next treatment. So this is now really a tumor biomarker, again, associated with a therapy, FDA approved, and oftentimes much easier to identify that PI3 kinase mutation through a liquid biopsy or ctDNA test than it would be maybe to repeat a tumor biopsy.